Today, we're diving into a pretty incredible surgery, one that doesn't just treat a stroke after the fact, it can actually stop one from ever happening in the first place. It's called a carotid endarterectomy.
I mean, just think about that for a second. What if you could surgically prevent a stroke? It's a huge question, right? The idea of being proactive, of getting ahead of one of the most feared medical events out there, well, that's exactly what this procedure is all about.
So let's start with a number, and it's a big one, 750,000. That's how many strokes happen just in the US every single year. But here's the kicker. The majority of them are what we call ischemic strokes, meaning they're caused by a blockage. And for a huge number of people, that blockage all starts in the very same place, with a problem we can actually fix.
So before we can talk about the solution, we've got to understand the problem. What is going on inside the body that's putting the brain at such a massive risk?
Well, the culprit has a name, carotid artery stenosis. The easiest way to think about it is this. Imagine the two big carotid arteries in your neck are the main fuel lines running to your brain. Stenosis is what happens when those fuel lines get clogged up with gunk, this fatty plaque, just like a rusty old pipe.
And that clogged artery, well, it becomes a ticking time bomb. And it can go off in one of three ways. First, little bits of that plaque can just break off and get fired straight into the brain. Not good. Second, that rough, unstable plaque is the perfect place for a blood clot to form, which can either grow and block the artery right there or break off itself. And third, the artery can just get so narrow that it starts to literally choke off the brain's blood supply.
Okay, so if the problem is basically a clogged pipe, what's the solution? Well, surgeons came up with a brilliantly direct approach, a kind of roto-rooter for your arteries. They figured, why don't we just go in there and physically clean out the pipe?
And that's exactly what a carotid endarterectomy, or CEA for short, is. The goal is just beautifully simple. Open up that clogged artery, surgically scrape out all that dangerous plaque, and get the blood flowing freely to the brain again.
Now, this surgery didn't just appear overnight. It was actually first tried way back in the 1950s, and it took decades to perfect. But then, in the 1990s, a series of huge clinical trials came out, and they settled it. They proved, without a doubt, that this procedure was not only safe, but an incredibly effective way to prevent strokes.
All right, so let's pull back the curtain and take a peek inside the operating room. What does this procedure actually look like?
I mean, it sounds almost impossibly delicate, doesn't it? Slicing open a major highway to the brain to, what, scrape out the inside? You better believe it takes an incredible amount of precision and skill.
So, the most common way to do it involves 4 main steps. First, the surgeon makes an incision in the neck to get to the artery. Next, they have to clamp it off to temporarily stop the blood flow. Then comes the critical part. They open up the artery and very, very carefully peel out that plaque. And finally, they stitch the artery shut, often with a little patch, kind of like a patch on a tire, to make sure the artery stays nice and wide.
Now, there is another way to do it, called an eversion CEA. In this version, instead of just making a slit, the surgeon actually cuts the artery in two, turns the end almost inside out like you're taking off a sock to peel the plaque out, and then sews it back together. So 2 different techniques, but they both get you to the exact same place, a clean, open artery.
Of course, this is surgery, and any surgery, especially one like this, is going to have risks. So to really understand this procedure, we have to look at the other side of the coin and talk about the potential complications. So the big risks are things like stress on the heart or big swings in blood pressure. That's what hemodynamic instability means. But I know what you're looking at. That big slice of the pie, cranial nerve injury at 45%. That number looks terrifying, right? But it is so important to understand what's really going on there.
And here is the crucial context for that nerve injury risk. The vast majority of these cases are temporary. We're talking about bruising or stretching the nearby nerves that control your tongue or your voice. And yeah, that can be frustrating, but these issues almost always get better on their own within a few months. Permanent, lasting damage, that is incredibly rare. We're talking less than 2% of the time. So that brings us to the big question, the most important question of all. After you weigh all the risks, what's the payoff? Does cleaning out this artery actually prevent strokes? Well, let me tell you, the evidence is not just convincing, it's overwhelming.
The proof is right here in the data. Look at this chart from a famous study called the NASCET trial. It looked at patients who already had symptoms, like a mini-stroke.
With just medical therapy, their risk of having a major stroke over the next 2 years was 26%. But with surgery, it dropped all the way down to just 9%. That is a massive, life-changing difference.
But what about stopping that very first stroke? In people who haven't had any warning signs yet? Well, 2 other giant trials, ACAS and ACST, answer that question. They found that for patients with a really bad blockage, the surgery cut their 5-year risk of having a stroke or even dying by about half. It's just incredible.
So when you boil it all down, it comes to this. The evidence is just crystal clear. For the right patient, someone who is carefully selected and has significant carotid artery disease, this one-time surgical procedure can cut their long-term risk of a disabling stroke by more than half.
And all this leads to a really interesting question for the future. As our medicines for managing cholesterol and plaque get better and better, will a surgery like this eventually become obsolete? Or will there always be a place for physically going in and removing a threat that's sitting right on the brain's doorstep? It's a fascinating debate, and one that doctors are looking at right now.